Welcome to another episode of the Bark Brigade podcast by Doggozila Magazine.
Glad to be here.
So right now, your dog might actually be walking on a time bomb. And I know that sounds dramatic, but every time you hear that familiar click of their nails on your hardwood floor, you aren't just hearing a reminder to call the groomer.
Oh, definitely not. It's much
Right.
deeper than that.
You're actually listening to the sound of their skeletal system being like microfractured out of alignment, step by step. I mean, we rarely think about it, but our dogs don't walk on their feet the way we do, right? They walk on their toes.
Exactly. They are what we call digitigrades.
And those toes are highly sensitive, biomechanically complex structures that basically bear the entire kinetic force of their bodies. So today we are doing a deep dive into a really comprehensive guide from Doggozila Magazine. It's written by Helen Thompson, and it's titled Dog Split Nail Problems and Treatment.
It's a fantastic resource.
It really is. And our mission today is to take what is arguably the most dreaded, anxiety-inducing chore in dog ownership.
Oh, absolutely. The dreaded nail trim.
Yeah, exactly, the nail care. We want to break down the anatomy, the biomechanics, and the behavioral psychology to really transform it from, a wrestling match into a masterclass in canine health and trust.
And that is such a critical shift in perspective because we tend to view dog nails as just, dead keratin, like our own fingernails, right?
Just something annoying you have to clip.
Right, but canine nails are fundamentally different. They're actually active, weight-bearing appendages. I mean, they are designed to dig into dirt for traction, to pivot at high speeds, and to absorb shock.
Which is wild when you think about it.
It is, but the problem is that modern domestic environments completely betray that evolutionary design. Our dogs are walking on smooth hardwood, tile, and concrete.
Instead of like the very soft dirt their ancestors navigated.
Exactly. And because of this environmental mismatch, nail health has basically become one of the most overlooked indicators of a dog's overall systemic well-being. A seemingly minor issue with the nail doesn't just affect the toe. It literally alters their entire physiological framework.
And when that framework fails, it fails incredibly dramatically. The source material draws a really sharp, very bloody distinction right out of the gate between a split dog nail and a broken dog nail.
Yeah, that's a crucial distinction to make.
Right, and I want to start here because this is the crisis moment. The guide defines a split nail as a visible crack or damage to the nail itself. So it splits down the middle or along the side, sometimes traveling all the way up to the nail bed.
And then you have the broken nail.
Yeah, which the guide describes as being torn completely, usually from getting physically caught on something like, the slats of a wooden deck or a thick root in the yard, and it just physically snaps or tears off.
Which is an awful experience for the dog.
It is.
Yeah.
But whether it's a split or a break, the result is exactly the same. You get an incredible amount of blood and a dog in absolute agony. And I guess my question is, why is the reaction so severe? If I break my fingernail, it's annoying, maybe it stings a bit, but I'm not screaming in pain on the floor.
Right. Well, to understand the severity of that reaction, we really have to look closely at the internal anatomy of the canine claw. Like you mentioned, your fingernail is just a flat plate of dead keratin resting on top of a nail bed.
Yeah, and I don't walk on it.
Exactly. You don't put weight on it.
Wow.
A dog's nail, structurally, is more like a hollow cone of hard keratin that encases this living, highly vascularized core.
Okay, the quick.
Yes, we call it the quick. But honestly, the term quick doesn't quite do justice to what it actually is in a biological sense. It's this dense, fleshy pulp comprised of a major blood supply.
Like an artery.
Yeah, an arterial loop. And it has an incredibly high concentration of nociceptors,
Nociceptors.
basically specialized nerve endings. They detect tissue damage and transmit pain signals directly to the brain.
Oh, wow. So when a nail splits, that crack isn't just happening in the dead shell on the outside.
Not at all. The structural failure of the hard keratin exposes that highly pressurized, nerve-dense pulp right to the open air. So when a nail catches on a deck slat and tears, the mechanical force shears right through the living tissue.
That sounds horrific.
It is. You are essentially dealing with an amputation of an appendage.
Wait, really? An amputation?
On a micro level, yes. The reason it bleeds so profusely is due to the arterial pressure pumping down into those extremities to supply the tissue.
And I guess the reason the dog's reaction is so dramatic is because those exposed nerves are now grinding against the floor or the grass with every single movement.
Exactly. Every time they try to step, they are dragging an exposed nerve ending against the environment.
Which honestly makes the first aid protocol the guide outline sound incredibly daunting. Let's say we're dealing with a small split and minor bleeding. The guide gives us a clear step-by-step.
It's a very solid protocol.
Yeah. Step 1, keep the dog still and calm. Step 2, gently wipe the area with a clean cloth. Step 3, apply styptic powder directly to the split to stop the bleeding. Step 4, wrap the paw with a sterile pad or gauze, securing it with tape but not too tightly. And Step 5, monitor for signs of infection in the following days.
Simple enough on paper, right?
Right. But I have to admit genuine confusion, or at least skepticism, about Step 1. I mean, if the quick is a raw, exposed nerve and arterial blood is pumping onto my living room floor, and my dog is already in a state of sheer panic, how on earth are we supposed to keep them still and calm?
Yeah.
It feels like telling someone in a car crash to just relax.
I completely understand that skepticism. It's the most difficult aspect of the protocol, without a doubt. But biologically, it is the absolute most essential step.
How so?
Because when the injury occurs, the dog's sympathetic nervous system activates instantly. Their brain floods with adrenaline and cortisol.
They're panicking.
Total fight or flight. Their heart rate spikes, which, if you think about it mechanically, actually pumps more blood out of the wound faster. Oh, right, because their heart is racing.
Yes. What we really have to understand about canine psychology in that exact moment is that they are actively looking to their environment.
Meaning looking at us.
Yes, looking specifically to you, their primary attachment figure, to assess the level of threat. Dogs are exquisite readers of human biometric data.
Wait, what do you mean by biometric data?
I mean, they can smell the changes in your sweat when you panic. They hear the elevated pitch of your voice. They see your erratic, jerky movements. So if you respond to the blood with panic, you validate their terror.
Oh, man. So if I start running around frantically looking for paper towels and tearing apart the bathroom for the first aid kit, my dog interprets that as, oh, we are actively under attack. I need to escape.
Precisely. And an animal trying to escape a perceived mortal threat while in excruciating pain is going to thrash, they might bite, and they will absolutely cause further structural damage to that torn nail.
That makes so much sense. Right. So overriding your own human instinct to panic is actually the first true medical intervention you perform. You have to force your own respiration rate down.
Take a deep breath.
Yes. Lower your center of gravity by kneeling or sitting quietly. Speak in a low, rhythmic tone. And the guide highly recommends having a second person assist, if possible, and this is exactly why.
So one person manages the panic, and the other manages the paw.
Exactly. One person needs to manage the dog's psychology while the other manages the physiology. One person stabilizes the dog against their body to provide deep pressure therapy.
Which kind of acts like a weighted blanket, right?
Yes, it actually helps lower the dog's heart rate. And they can distract them, maybe with a really high-value treat, while the second person addresses the bleeding.
Okay, so let's talk about addressing the paw. Specifically, Step 3. Applying the styptic powder. I understand the styptic powder stops the bleeding. But if we just establish that the quick is a raw, exposed nerve, isn't packing chemical powder directly onto it just agonizing?
It's a very fair question.
I mean, are we just trading the trauma of the bleeding for the trauma of a chemical burn?
That's a very astute observation, and the honest answer is yes, it does cause a brief, intense sting. But we have to look at the mechanism of how styptic powder actually works to understand why it's a completely necessary trade-off.
Okay, what's it actually doing?
The active ingredient in most veterinary styptic powders is something called ferric subsulfate. When this chemical comes into contact with blood, it acts as a very powerful astringent.
Meaning it dries it out.
More than that, it doesn't just encourage natural clotting, it actively forces the proteins in the blood to precipitate and clump together instantly. It rapidly dehydrates the tissue at the very surface of the wound.
Oh, wow.
Yeah, creating a physical, hardened plug that seals those ruptured blood vessels.
So it's basically spot welding the wound shut chemically.
Spot welding is a highly accurate way to visualize it, yeah. Because the blood is flowing out with arterial force, a normal bandage often just isn't enough to stop it. The blood will literally just soak right through the gauze.
Right, because of the pressure.
Exactly. The ferric subsulfate creates an immediate structural barrier. Now, it does sting sharply for a moment as it reacts with the raw tissue, which is why the restraint and calmness we just discussed are so incredibly vital.
Because if they flinch?
Right, if the dog jerks their paw away during that sting, the plug won't form correctly, and the bleeding will just resume.
That sounds intense. Okay, so once the plug is formed, the guide instructs us to wrap the paw with a sterile pad or gauze. And there's a key caveat here. Not too tightly. Why is that so crucial?
Because the paw is an extremity. If you wrap it like a tourniquet, you cut off the venous return.
Meaning the blood can't get back up the leg.
Yes, which causes the foot to swell massively and can actually lead to tissue necrosis where the tissue dies. The wrap is simply there to protect the chemical plug from being licked off or knocked loose while the dog walks.
Okay, so we see the blood, we overcome our panic, we apply the powder, we wrap the paw, and we basically survive the crisis.
Yeah.
But dealing with an acute, loud injury like a split nail raises a much more insidious question, I think.
Where are you going with this?
Well, if an acute trauma causes this much systemic chaos, what about the damage we don't see? Because a traumatic split often happens when the nail's structural integrity is already compromised.
Ah, yes, the underlying issues.
Right, and that transitions us perfectly into the hidden chronic pathologies that the Doggozila Guide outlines. The bleeding nail screams for attention. But conditions like overgrown nails, ingrown nails, and silent nail bed infections, those are slowly deteriorating the dog's health right under our noses.
And those quiet conditions are often far more damaging over the span of a dog's life than a single split nail. Let's analyze the most common issue the guide brings up, which is overgrown nails. This goes back to our earlier discussion about the dog's skeletal framework.
Right, the digitigrade thing, walking on toes.
Exactly. When a healthy dog stands on a flat surface, their paw pads should bear the weight, and their nails should hover just slightly above the ground. They should only engage when the dog pushes off to run or when they're climbing an incline. But when the keratin grows too long, the tip of the nail makes contact with the hard floor before the paw pad does.
Which creates that clicking sound we talked about earlier.
Yes. And that clicking sound is literally the auditory evidence of a severe biomechanical failure.
Wait, calling it a biomechanical failure sounds really serious.
It is serious. Because the floor is unyielding, the force of the dog's weight pushes the long nail upward and backward into the toe.
Oh, I see.
To conceptualize this, imagine standing barefoot right now. Now imagine someone sliding a marble under each of your toes, forcing them to point upward.
That sounds terribly uncomfortable.
It is. The kinetic energy of every step you take can no longer be absorbed by the natural shock absorbers of your foot. It forces your flexor tendons to stretch abnormally.
Let me try an analogy here. It sounds like walking in ski boots on concrete.
Oh, that's good.
Because your toe is locked into an unnatural upward angle, right?
Yeah.
It can't flex downward to absorb the impact. So the kinetic energy of every single step shoots straight past the foot and hammers directly into your ankle and knee joints.
That is an excellent biomechanical comparison. In the dog, that upward pressure on the toe misaligns the phalanges, the actual toe bones. And to compensate for the pain and instability of that, the dog naturally shifts their center of gravity backward, rocking onto the heel of their paw pad.
Like they're leaning back permanently.
Yes, and this postural shift throws the carpal joint, their wrist, completely out of its natural alignment.
Oh, wow. So it travels up the leg.
The kinetic chain reaction absolutely does not stop there. The altered angle of the wrist changes how the radius and ulna bones bear weight. That strains the elbow, which then forces the shoulder muscles to overcompensate.
And in the back legs.
In the hind legs, it alters the angle of the stifle, which is their knee, and ultimately the hip joint.
So just by ignoring a simple grooming task, we are essentially forcing our dogs into a chronic orthopedic crisis.
Without exaggeration, yes. Over months and years, this constant unnatural friction and joint misalignment accelerate the degradation of the cartilage. It directly contributes to early onset osteoarthritis.
That is heartbreaking.
It is. The dog becomes reluctant to walk, their gait becomes stiff, and they just live in a state of chronic, dull, aching pain.
And that is just from the nails being too long. But the guide also highlights a more localized, acute pathology, the ingrown nail. Now, this typically occurs on the dew claws, right?
Yes, the dew claws are the most common victims of this.
The dew claws are those little thumb-like digits higher up on the inside of the
Yeah.
leg, yeah. The ones that don't even touch the ground.
Correct. They're basically evolutionary remnants for most breeds. And because they don't make contact with the ground, they receive zero natural friction from walking.
So they just keep growing.
If they aren't manually trimmed, yes. The keratin continues to grow in its natural curved trajectory until it completes a full circle, and the sharp tip begins to press into the soft tissue of the dog's leg or paw pad. Eventually, it physically punctures the skin.
Which creates a perfect storm for the infections the guide warns us about.
It really does. The paw pad is covered in a thick layer of stratum corneum to protect against rough terrain. But underneath that tough exterior is soft adipose tissue and a very rich blood supply.
So when it punctures.
When the ingrown nail breaches the skin, it drives whatever environmental debris, dirt, and bacteria were resting on the outside of the nail deep into the tissue.
Ugh, like a dirty needle.
Exactly. Furthermore, because the nail is literally plugging the hole it just created, it forms a dark, moist, anaerobic pocket inside the tissue. It is the absolute ideal incubation chamber for pathogens.
And the guide lists bacteria, fungi, and parasites as culprits for dog nail infections. I assume this is where we start seeing the behavioral symptom that the article emphasizes heavily, which is excessive paw licking.
Yes, licking is the big red flag here.
I think it's incredibly common for owners to see their dog curled up on the rug, obsessively licking one paw, and we just write it off. We think, oh, he's just grooming himself or she's just bored. But the source explicitly states that excessive licking is a primary indicator of pain, discomfort, or anxiety.
We really have to reframe how we view canine licking. While dogs do groom themselves normally, obsessive localized licking is a self-soothing mechanism in response to a localized pathology.
What are they actually doing when they lick it?
Well, dog saliva contains natural pain-killing properties, specifically a compound called opioorphin.
Wait, really? Like a built-in painkiller?
Yes. So when a dog's toe joints are aching from the structural misalignment we discussed, or when a fungal infection is colonizing the nail bed, they are licking to deliver that opioorphin and to physically massage the inflamed tissue.
But doesn't the licking actually make a fungal infection worse? I mean, it's wet.
It creates a devastating feedback loop. Fungi, particularly a common yeast called Malassezia, absolutely thrive in warm, moist environments.
So the licking is feeding it.
By constantly licking the paw, the dog is macerating the tissue, basically breaking down the skin's natural barrier and keeping the area perpetually damp. The yeast population explodes, which causes intense pruritus or itching.
So it itches more, so they lick more.
Exactly. They lick more to soothe the itch, adding more moisture, feeding the yeast further. You can actually smell it. A severe yeast infection on a dog's paws often smells distinctively like corn chips or old bread.
Okay, if an owner is noticing that corn chip smell, or the chronic licking, or they see a nail starting to curl dangerously close to the pad, at what point does home maintenance end and veterinary intervention begin? The guide outlines several red flag symptoms.
The threshold for veterinary care is crossed the moment systemic or deep tissue involvement is suspected. The guide is very clear on this.
So what are we looking for?
Well, if you have a deep split with excessive bleeding that simply will not stop despite applying styptic powder and pressure, that requires a vet, as an artery may literally need to be cauterized.
Or what about infections?
Any visual signs of severe infection, such as noticeable swelling of the digit, pervasive redness, any form of purulent discharge or pus, or a necrotic, rotting smell, those mandate immediate professional care.
Because it's spreading.
Right. The infection has likely breached the superficial layers and could be threatening the bone itself, which is a condition known as osteomyelitis.
And obviously, if the dog is exhibiting extreme pain, refusing to let you anywhere near the paw, or showing systemic signs like lethargy, fever, or hiding, you don't wait. You don't try to fix that at home.
Exactly. A dog that is hiding or lethargic is a dog whose immune system is actively fighting a systemic battle. At that point, antibiotics, antifungals, and professional pain management are required.
But the frustrating part is that a lot of this could be avoided, right?
That is the real tragedy of these complex paw pathologies. Aside from the occasional unavoidable trauma of catching a nail on a root in the yard, almost all of these conditions, the joint degradation, the ingrown punctures, the yeast loops, they are entirely preventable.
Which brings us perfectly to the mechanism of prevention. If we know that chronic licking indicates a misaligned joint from overgrowth or an anaerobic infection from a puncture, how do we intercept that biological process before the damage becomes permanent?
By getting ahead of the growth cycle.
Right. We have to shift from being reactive to being proactive. The guide focuses heavily on building a preventative routine, specifically recommending a trimming schedule of every 2 to 4 weeks. But I imagine that window isn't totally arbitrary, right? It must be tied to the actual biology of how fast the keratin synthesizes versus how much it wears down naturally.
That is exactly the dynamic at play. Keratin growth is continuous, but the rate of wear is highly variable based on environmental friction coefficients.
Meaning what they walk on.
Yes, the 2 to 4 week rule is a solid baseline, but you absolutely must calibrate it to your specific dog's lifestyle. If your dog's daily exercise consists of walking 2 miles on hard concrete or asphalt, those rough, abrasive surfaces act like a continuous emery board.
Oh, so it files them down as they walk.
Exactly. The friction essentially files the tip of the nail down naturally, meaning you might only need to intervene manually every 4 to 5 weeks. Or perhaps you only need to trim the dew claws that don't touch the ground.
But if you have a dog that primarily walks on soft grass, dirt trails, or spends 90% of their time indoors on plush carpet, they're getting almost zero natural abrasive friction. The keratin is synthesizing way faster than it's being worn away.
Precisely. In that scenario, you will absolutely need to adhere to the 2 week end of the spectrum. But even with natural wear, as the guide points out, natural friction does not replace the need for regular visual inspections.
Because they walk unevenly.
Right. Different toes bear weight differently. A dog might wear down their front middle toes perfectly, but the outer toes might be growing abnormally long.
So we really need a system. The source material outlines the components, and I think we can synthesize them into a highly specific monthly home maintenance checklist. Let's break this down into 4 clear steps for the listener.
Let's do it.
Okay, step 1 is the assessment. You don't even have the tools in your hand yet. You are just looking. You are checking the symmetry of the nails, looking for micro cracks before they become deep splits, checking the angle of the toes to see if they're being pushed up, and feeling the pads for heat or swelling.
The assessment phase is absolutely crucial because you are establishing a baseline of what normal looks like for your specific dog. You are looking at the architecture of the paw before you attempt to alter it.
Exactly. Then step 2 is the tool check. The guide emphasizes using proper, sharp dog clippers or a designated nail grinder. Let's talk about the physics of the tools, because I think people massively underestimate how much a bad tool contributes to the pain.
Oh, without a doubt. The physics of the cut directly dictate the dog's experience. There are generally 2 types of manual clippers, guillotine style and scissor style. But regardless of the style, the blades must be razor sharp.
What happens if they aren't?
When a blade is dull, it doesn't slice cleanly through the hard keratin shell. Instead, it crushes the structural walls of the nail inward before it finally breaks through.
Which means it's squeezing that highly sensitive pressurized inner quick we talked about earlier.
Exactly. Even if you don't cut the quick itself, the hydrostatic pressure created by crushing the outer shell pinches the nerve endings inside. The dog feels a sharp, sudden pressure spike. It is highly uncomfortable and very startling.
And a sharp tool avoids that.
Yes. A sharp blade shears cleanly through the keratin without deforming the shape of the nail, bypassing that pressure spike entirely. Now, grinders, or rotary tools, operate on a different physical principle.
They use abrasion, right? Like sanding.
Correct. Abrasion rather than shearing. This avoids the crushing action altogether, which is great, though they do introduce vibration and noise, which we will definitely discuss later.
Okay, assuming we have sharp, high-quality tools, we move to step 3, the precision cut. Now, this is where the anxiety peaks for the owner, because the absolute golden rule from the guide is to identify the quick and only trim the dead tip. If you cut into the living tissue, we are back to the arterial bleeding and the screaming dog.
It's the most high-stakes part of the process.
Right. And for a lot of owners, identifying the quick feels like trying to defuse a bomb where you can't clearly see the wires. With white or translucent nails, it's easier, right?
Yes. With translucent nails, the anatomy is visibly demarcated. The dead keratin shell is clear, and you can visibly see the pink triangular shadow of the vascular pulp, the quick, right inside.
So you just avoid the pink.
You simply make your cut in the clear zone a few millimeters ahead of the pink triangle at a 45-degree angle that matches the natural curve of the nail.
But millions of dogs have pitch black nails. You can't see a shadow. You can't see the pink. How does an owner safely execute step 3 without just guessing and praying?
Guessing is exactly what leads to trauma. With black nails, you have to abandon the side profile view entirely and change your visual perspective to the cross-section of the nail.
Meaning looking at it head on.
Yes, you look directly at the tip of the nail head on. The technique requires making very thin, progressive shavings rather than one large, bold cut.
Just tiny little slivers.
Exactly. You shave off a millimeter of the tip and look at the newly exposed flat surface. Initially, that surface will look chalky, dry, and uniformly grayish-white. That is the dead keratin.
So if it's chalky and white, you make another tiny cut.
Yes. And as you shave slightly deeper, moving closer to the living tissue, the appearance of the cross-section changes. The center of the cut surface will begin to show a small, distinct, dark oval or a softer, grayish-pink dot.
Oh, like a bullseye.
Like a bullseye. Some groomers describe it as looking like the marrow inside a soup bone. That distinct center spot is the very beginning of the living pulp.
And that's when you stop.
The very moment you see that texture and color change in the center, you stop. You have reached the absolute safe limit.
That structural transition is the stop sign. That is brilliant, and it removes so much of the guesswork. Okay, and finally, step 4 of our routine is the post-play inspection.
A very overlooked step.
Yeah, the guide notes that outdoor activities are where most acute damage actually happens. They recommend checking the paws frequently after play, and even using booties to protect against rough surfaces. I think people often view dog booties as a silly fashion accessory, but there's real utility there, isn't there?
The utility is immense, particularly regarding thermoregulation and abrasive trauma. A dog's paw pads are incredibly resilient, but they are not impervious to physics.
No animal is.
Right. In the winter, jagged ice can slice the pads open, and urban road salt causes severe chemical burns. In the summer, asphalt absorbs solar radiation and can easily reach temperatures exceeding 140 degrees Fahrenheit.
Which will fry an egg, let alone a paw.
It will cause second-degree thermal burns to the tissue in a matter of minutes. Booties provide a necessary mechanical and thermal barrier when the environment is hostile.
So step 4 is just making a habit of checking.
Exactly. Step 4 is simply the habit of turning the paw over after a hike or a run to ensure no glass, thorns, or debris have punctured the pad or lodged between the toes where they can fester and cause an abscess.
So, this 4-step checklist assessment, tool check, precision cut, and post-play inspection. It's a fantastic logical system. I am completely on board with it.
It works beautifully if followed.
However, we really have to address the massive elephant in the room here.
The behavior.
Yes, this entire biological and mechanical discussion assumes we're working with a cooperative, static subject. But let's look at the real-world application. What happens when you diligently do your assessment, you pull out your perfectly sharp scissor clippers, and your dog takes one look at the metallic tool in your hand, tucks their tail, and immediately scrambles under the bed, shaking?
It's incredibly common.
Or what if the mere sound of the grinder clicking on makes them bare their teeth and growl? All the anatomical knowledge in the world is totally useless if the patient is fighting for their life.
And that exact transition is where most owners fail. Because they try to solve a psychological problem with physical force.
Just hold him down.
Right. They think, I just need to hold him tighter, or we just need to get it over with quickly. We have to pivot entirely from biomechanics into behavioral neurology here. The final section of the guide is essentially a masterclass in desensitization. To successfully treat a fearful dog, we first have to understand the actual architecture of their fear.
Where's it coming from?
Well, dogs are not born with a biological aversion to pedicures. A puppy doesn't inherently fear a nail clipper any more than they fear a spoon.
So how does the phobia develop? What are they actually reacting to when they freak out?
They are reacting to a combination of 3 specific triggers: a loss of bodily autonomy, unfamiliar sensory input, and most profoundly, the neurological consolidation of past trauma.
Let's break that down. Autonomy first.
Right. When an owner grabs a dog's leg and restrains them tightly, it triggers an innate opposition reflex. The dog physically feels trapped. Second, the sensory experience of pressure on their highly sensitive digits or the high-frequency vibration of a grinder is deeply unnatural to them.
And the third trigger, past trauma.
The most powerful factor is memory. If a dog has been quicked in the past, if the owner accidentally cut into that highly vascularized, nerve-dense tissue we discussed, the dog experienced a sudden, sharp, intense pain.
And the brain logs that event.
The brain aggressively hardwires that event for survival. The amygdala, which is the fear processing center of the brain, creates an immediate, unbreakable association between the visual stimulus of the clippers, the environmental context of the owner grabbing the paw, and the sensation of excruciating pain.
So they aren't just being difficult.
No. The next time the clippers appear, the amygdala bypasses the rational parts of the brain entirely and instantly triggers the sympathetic nervous system. The dog isn't being stubborn, they are experiencing a physiological panic attack.
I think about this like human exposure therapy.
It's very similar.
Like, if someone has a severe clinical phobia of spiders, a therapist doesn't start their very first session by dropping a live tarantula on their lap and saying, just hold still, it'll be over in a minute.
That would be malpractice.
Right, that would be called flooding, and it would just traumatize them further, potentially causing a psychotic break. You start by looking at a cartoon picture of a spider from across the room. You look at the picture, you take deep breaths, and you realize you are safe.
Exactly.
And then maybe the next week, you look at a photograph. A month later, maybe there's a spider in a sealed jar at the far end of the hallway. You slowly, incrementally build tolerance. But with dogs, our instinct is to just grab the paw and go for it, which is the exact equivalent of dropping the tarantula on their lap.
That is an exceptionally accurate analogy. Flooding, which is forcing the animal to endure the terrifying stimulus without any route of escape, only deepens the trauma, and it often leads to defensive aggression.
Which is when they start biting.
Yes, that's when the dog realizes that biting is literally the only way to make the scary things stop. To prevent that, the guide provides a specific alternative: a desensitization and counter-conditioning protocol.
Two different things.
Yes, desensitization is the slow exposure to the stimulus, like the spider in the jar you mentioned. Counter-conditioning is changing the underlying emotional response by pairing the scary stimulus with something incredibly positive.
So changing how they feel about it.
Exactly. We are trying to rewire the neurological pathway so that the sight of the clippers predicts a rush of dopamine from a high-value treat rather than a spike of cortisol from anticipated pain.
The guide outlines the steps for this, and I want to walk through exactly what this looks like in practice because the timeline is crucial. So step one is simply introducing the tools.
Correct. No touching yet.
You don't touch the dog at all. You just place the clippers or the turned-off grinder on the floor. The dog looks at it, sniffs it, or even approaches it. You immediately mark that behavior with praise and give them a highly desirable treat.
Something they only get during this training.
Yeah, like boiled chicken or a lick of peanut butter. You do this for 2 minutes and then you put the tool away. You might do just this step for 3 straight days until the dog's tail wags when they see the clippers come out.
Because the clippers have now become a predictor of chicken, the emotional valence has shifted from negative to positive.
Exactly. Then step 2 is practicing gentle paw handling, totally independent of the tool. You just run your hand down their leg, touch the paw for 1 second, and give a treat. The next day, you hold the paw for 3 seconds, give a treat.
You are decoupling the touch from the trauma.
Step 3 is combining the elements. You hold the paw while the clipper is visible on the floor, or if you use a grinder, you turn it on at the other side of the room so they just hear the acoustic hum, and you feed them chicken.
Incremental progress.
Right. Step 4 is the tactile introduction. You touch the cold metal of the clipper to the outside of the nail without cutting and treat. Or you touch the vibrating base of the grinder to their leg, not the nail, so they feel the vibration and treat.
And this progression requires acute observation from the owner, which actually brings us to step 5 from the guide.
Which is recognizing stress signals.
Yes, knowing when to stop. If you introduce the sound of the grinder and the dog licks their lips nervously, yawns excessively, or pins their ears back, you have moved too fast. You have crossed their threshold.
So you stop immediately.
You must immediately stop, take a break, and the next day drop back to the previous successful step. The process has to be painfully slow because you are operating at the speed of the dog's neurological recovery, not the speed of your weekly schedule.
It requires an incredible amount of patience. But the guide also offers alternatives for dogs that are so profoundly terrified that even this slow protocol is just too much. And one of the options they highlight is using a scratching board or a file. I find this concept absolutely fascinating. It feels like a paradigm shift in how we approach animal husbandry.
It is a profound shift because it addresses the core issue of bodily autonomy we talked about earlier. A scratch board is essentially a piece of wood covered in coarse sandpaper. Using basic operant conditioning, you teach the dog to target the board with their paws, mimicking their natural digging behavior. When they drag their front paws down the board, the sandpaper files the nails down naturally, and you reward them with a treat.
It's brilliant. It completely removes the human hands, the restraint, and the scary metallic tools from the equation. The dog is entirely in control of the pressure, the duration, and the angle. They are essentially electing to give themselves a manicure because it's a fun game that results in a reward. You are giving the animal agency.
And giving an animal agency over their own physical manipulation drastically reduces their stress response. It empowers them. Now, scratch boards are primarily effective for the front paws, as dogs don't naturally dig with their hind legs in the same manner.
Ah, right. So what about the back legs?
For the hind legs, or for cases where the phobia is just too deeply ingrained to overcome at home, the guide makes a very important recommendation: utilizing professional groomers, veterinarians, or even discussing sedation.
I think there is a lot of guilt associated with that last point. Owners feel like they have failed if they have to ask the vet for a sedative just to cut their dog's nails.
We need to completely remove that stigma. If a dog's panic response is so severe that they risk injuring themselves or you, or if they are entering a state of severe psychological distress, chemical intervention is honestly the most humane and ethical choice.
Which is medicine.
Exactly. Modern veterinary medicine offers a range of options, from mild oral anxiolytics like trazodone or gabapentin given at home before the appointment, to full, brief, injectable sedation at the clinic. The ultimate goal is the physical health of the paw, preventing the arthritis, the infections, the splits. How you achieve that goal can and should be flexible based on the individual dog's psychological needs.
I want to speak directly to you, the listener, for a second. The source material outlines these protocols, but I want to make the practical reality very explicit. Please permanently abandon the idea that all 4 paws, all 16 nails, must be trimmed in one chaotic, stressful 10-minute session on a Sunday afternoon.
Hear, hear.
If you have a fearful dog and you manage to clip exactly one single nail on a Tuesday, followed by a jackpot of high-value treats and a fun game of fetch in the yard, that is a massive, unequivocal victory. It might take you 2.5 weeks to cycle through all the toes, but you are doing it while keeping their heart rate low, keeping their trust intact, and preventing the trauma from returning. That is the true win.
It completely reframes the objective. You aren't just completing a grooming task, you are engaging in a daily cooperative therapeutic exercise.
We have covered an immense amount of ground today, transitioning from acute trauma to chronic biology, all the way to behavioral science. Let's synthesize the core insights of this deep dive.
Sounds good.
We started by unpacking the crisis of the split nail, learning that the dramatic bleeding is due to the highly vascularized quick, and that applying styptic powder, despite the brief chemical sting, is totally necessary to structurally plug the wound. More importantly, we learned that the owner's calm demeanor is the first and most vital medical intervention to prevent the dog from thrashing and causing further damage.
From there, we examined the hidden chronic pathologies. We detailed how overgrown nails act as mechanical levers, forcing the toes up and misaligning the entire skeletal kinetic chain, leading to early onset arthritis.
Right. And we discussed how ingrown nails puncture the paw pad, driving surface bacteria and fungi deep into the tissue, creating anaerobic pockets of infection.
And we decoded the behavioral symptom of chronic licking, understanding that it isn't just grooming, but a self-soothing response to the pain and the fungal yeast cycles driven by that moisture.
We then built our defense mechanism, a proactive 4-step routine: the assessment to check for symmetry and damage, the tool check, ensuring we use sharp blades that shear the keratin rather than dull blades that crush the sensitive pulp, the precision cut, utilizing the cross-sectional bullseye technique to safely trim black nails, and the post-play inspection to check for environmental debris and protect the pads with booties against thermal and physical trauma.
And finally, we addressed the psychological barrier. We explored the neurology of fear, understanding that the amygdala hardwires the memory of past pain, turning the clippers into a phobic trigger. We learned to combat this not with force, but with classical counterconditioning, slowly pairing the sight, sound, and feel of the tools with high-value rewards to rewrite the emotional response.
We embraced the concept of agency through tools like the scratch board and validated the use of veterinary sedation for severe cases to prioritize the dog's mental well-being alongside their physical health.
It is a truly comprehensive roadmap to totally transforming how we care for our dog's feet. And I think it leaves us with something really profound to think about.
I agree. Go ahead.
When we take the immense amount of time required to slowly desensitize our dogs to paw handling, when we observe their stress signals, when we respect their fear, and when we work through it with incremental patience rather than physical dominance, we aren't just maintaining the length of their keratin.
It's bigger than that.
Much bigger. We are fundamentally teaching them that they can trust us when they are at their absolute most vulnerable. We are proving to them that our hands bring relief and reward, not pain and restraint. So ask yourself, if you can build that profound, unshakable level of trust, one paw, one tiny sliver of nail, one piece of chicken at a time, how might that deep bond transform every other aspect of your life and relationship with your dog?
Thank you for listening, dear Brigadiers. And if you have any questions, visit the source article on Doggozila Magazine at doggozilla.com. That was all for this episode, and until the next time, bye to all listeners of the Bark Brigade podcast.